Hey, Jim. Thanks for joining us on the Healthcare Wrap. I appreciate you being on the show.
Thanks for having me. It's a pleasure to be here.
Yeah, last time I caught you was at Health last year. A lot has happened since then, and now we're sitting here in Iowa at Nourishing Change, and I would love to just hear a little bit more about how the conference has been for you, and what's been catching your eye, your ear here so far this week.
Yeah, well, Health was a great event for us. That's when Hy-Vee, Ahold Delhaize USA, and Kroger announced the formation of the Steer Co., and that we were going to come together and work on the movement that would guide the work throughout the year, culminating in a conference each year. So that was the big announcement we made at Health. And so then we started to get some as much work as we could before the holidays and the end of the year to kind of form our agenda and start to enlist advisory council members. So we now have 20 advisory council members that are from the different stakeholders in the ecosystem that will be helping and inform and guide us in the strategy, as well as implementing the work plan with the 4 different work groups. So the 4 work groups that we have they're related to data and interoperability, clinical and payment system redesign, food for health, and then professional and workforce development. So I was hoping to get a little bit further along between Health and this conference on getting the work groups activated, but honestly, we shifted to really full-blown conference planning to make this event happen here in Des Moines. So this has far exceeded my expectations, and I couldn't be more proud. When we first said in May, when we were hosting this at Cincinnati at our headquarters, and we said, okay, we're going to Hy-Vee, everyone said, you're crazy. Like, the conference is too new. You have to have a couple more years under your belt. Des Moines, people aren't going to travel to Des Moines. And I said, the Hy-Vee team wants it. They're committed. I have full faith in them. They put on big events all the time. The World Pork Festival is here in Des Moines, actually going on the same time this week. So it's not like they don't host big events. So we rolled up our sleeves, and on a leap of faith, we said, we're going to Des Moines, and here we are. We've got double the amount of sponsors, double the amount of speakers. I think there's 120 speakers this time, 62 emerging brands, and close to 1,000 attendees. So we've actually grown in every category, which is really healthy. So there's been so many things that have caught my eye while we've been here. One is the space itself is different than when we were in Cincinnati. In Cincinnati, we were at the Hard Rock Casino, and it was smaller and intimate. This is at an expo center, so it feels like a conference, but the team has done a really great job with the activations, pickleball court, cornhole, an impact studio wall where people can post how they're impacting transformation and get their picture on the wall, and we're forming a mosaic from it. So lots of really cool things that's making this, what would be a blank canvas in a conference center feel really, really cool and special and intimate. But to me, it feels like we've arrived. Like, this would be like 5 years from now what I would have expected, and it feels it just feels really special, and I'm impressed by it. The main stage is just off the chain. I mean, with the lights and the effects and how big the stage is, and we packed the house. So all these things are excite me and inspire me that we're continuing to do the right thing. People are showing up, and we're gonna push on.
Yeah, this event has grown quickly. For those who aren't as familiar with it, tell us, you mentioned some of the stakeholder groups and some of the focus areas here. For those who aren't as familiar, who's generally attending this, and what are we generally talking about in the sessions?
Well, I think that's one of the strengths of this conference is the attendees are so diverse. So we have government. We had Amy Gleason from DOGE to speak yesterday. We had the governor here speaking. We have HHS representatives here, so government is here, and I'm hoping that segment continues to grow. Health tech, CPGs and suppliers, which includes food and OTC, healthcare providers, health systems. Someone from MD Anderson was speaking on a panel yesterday. Nonprofits, academia. Joey Madeline from the University of Utah was speaking yesterday about new drug pricing models. So I feel like we have a really nice representation of the ecosystem, from providers, and payers. I mean, how could I forget the payers? We had PBMs here, which that was maybe the more controversial thing, because PBMs of late have been demonized. They've been the subject of new regulations, but they're here. Health plans are here. So that is definitely one of the strengths of this event.
Fantastic. If you had to whittle it down, that's probably the hardest part, whittling it down, but like picking a couple of key messages or things that you heard while you're here, either from the stage, from one of the sessions, or just someone you've been talking to out in the hall. What are a couple of those main things that they're going to stick with you for a while?
Well, I'll give you my answer, but I mean, this is really personalized for me because I think there was such a wide range of topics that there was something for everybody. So for me, I would say that Amy Gleason's talk yesterday, where she was talking about CMS's interoperability initiative in the health tech ecosystem and how pharmacy is going to play within that really hit home. And we've actually started to do some work with Doge on that matter, because pharmacy was not necessarily excluded from the initiative, but it wasn't maybe necessarily a leading thought of how to include pharmacy in interoperability. So we've had some great discussions of how we plug into that ecosystem. So that really hit home for me. We've had some great discussions with the direct primary care initiative that's going on here in Iowa, that's led by Hy-Vee and their company Exemplar, and their growth and expansion throughout all of the markets that they're in, that they really want to saturate. And we have clinics also, but it's a different model. It's a nurse practitioner led model, and they're doing concierge physician medicine. And I think that's a really unique model, and honestly, I would argue the model of the future. So that's really hit me of like, how do we bring that kind of model to Cincinnati? And there's been, I mean, the microbiome session was packed out. There was the session I mentioned about from MD Anderson talking about cancer. This isn't published yet, but he talked about it from stage, so I feel like I can repeat it. But he said that they did a study on people that had advanced melanoma that were on immunomodulating therapy, and they had two groups, one that was randomized to a fiber group that you had to take in 50 grams of fiber per day, and the other one that you had to take in, I think it was 10 grams of fiber a day. Now, just so you know, like the average American diet gets probably about 10 to 15 grams per day if we're lucky. And so to get to 50 would be really something intense. So I think that in average they found that they got to 35, but the results that they found that the people that were able to get to 35 grams of fiber a day actually had 2.5% better response rate to their chemotherapy. So you want to talk about food as medicine or food for health, that's incredibly impactful. So then the question is how do you get that much fiber in your diet without feeling sick or with foods that you're going to enjoy? So that brings it to this emerging brands and all these other suppliers that are part of this conversation to say, like, okay, how do we incorporate more fiber? How do we reformulate our products? How do we motivate patients to change their behavior to incorporate more fiber in their diet? So I mean, we could spend hours just talking about the things that I've heard at this conference so far.
For sure. So when you look outside after this week, I mean, today's the last day here, right? Yeah. So after this, you go forward, what do you hope is the impact? Like, what do you hope this does for us, not just as an industry, but the intention is very clearly, you referred to it, this is a movement.
Right.
This isn't just, hey, let's gather and talk. Like, there's intended action that comes from all of this. What do you hope some of that is, some of the impact on our society?
Right. Well, my hope is that there's a ripple effect, that we put all of these thought leaders and different stakeholders from all these different segments into one forum, and that there's going to be this natural collaboration that starts to exist, this organic conversation that will continue on. And then, just like I just stated a few ideas, I'm hoping that everybody here has a few ideas that they're going to take back and start to implement. So, the future, and as we start to go down this plan for the next year and activating these work groups, I'm hoping that there's collaboration. I'm hoping that there's connection. I hope we make meaningful progress in interoperability. I'm hoping we make take new ground on payment redesigns and new models of care that will help our communities.
Fantastic. Well, let's hope for that. That's the impact that goes well beyond the event itself. So, okay, so you put your Kroger hat on, especially here. Like, what can you tell us about kind of where you have been celebrating lately, or what's coming? Anything between now and the end of the year? This isn't going to be the last year this event happens. So, what can you share with us about what's coming next?
Well, what's coming next is we'll start planning 2027, June of 2027. Mark your calendar. I hope you can come. We'll be doing that. We'll start conference planning immediately. But there's a lot that we're celebrating and continuing to work on throughout this year. One of which is we just got to the 90% mark of all of our SKUs in our stores that have a food health score associated with it. So now we're aggregating those scores, we're training it over the course of time, and we're kicking off a study to associate that with healthcare outcomes and utilization. So to me, that's going to be the holy grail. I mean, we know that eating better leads to better health, less costs, less bad things happen to you. But we can't empirically show it that what you purchased then leads to less costs and better outcomes. And if we can, and we can show an order of magnitude of difference, I think that changes the game for even reimbursement and sustainability of food for health initiatives. Now, all of a sudden, payers will know, like, okay, if my population, if their baseline is X and we improve it to Y, my costs go down by this much. I'm willing to maybe fund some initiatives that are targeted on exactly doing that. And if we start to put our heads together collectively as an industry on what are the best ways to inspire change in our customers, how do we get them to purchase better? How do we incentivize them, reward them for purchasing better? And then they get these better outcomes. There's a win-win for everybody involved.
I love that. Jim, thanks so much for your time taking it to speak with me today. Best of luck with everything going on the conference day. We'll finish strong and looking forward to next year.
Awesome. Thank you.